We're a couple minutes after the hour. We have a pretty good chunk of our attendees rolled in. I shouldn't be surprised, but I'm a little bit surprised. The registrations for this webinar are as good as we've had in a couple of years, really, since we've started doing these since COVID, which shows that there's a lot of interest in this subject. So as we get the last few people rolling in, I'm going to introduce Ian here to you, and then I'm going to hand it over to him. Ian Wetherell is a senior director with Principal Global Investors. And as you are going to quickly learn, he's an expert on helping people maximize Social Security income and managing the expenses that Medicare represents to people in retirement. So I mentioned this already. It's pretty easy as we contemplate retirement for people to overlook this important kind of Medicare component to things. And that's where Ian's expertise comes in here. Ian is I mentioned he's a senior director with Principal Global Investors. He's actually been in the financial industry since 1999. He joined as an advisor at Payne Weber and has moved on to John Hancock Nationwide, and here he is with Principal now. Ian, with that introduction, I'm going to hand it over to you, and I'm actually going to make you the host so you can roll through your slide deck here and take it away.
Great. Well, thank you so much, Brian. And thank you all for tuning in today. And Brian, I'm grateful for you having me on. As Brian mentioned, my name is Ian Wetherell with Principal. And, it's funny, since 2007, I've been a passionate advocate of the topics that Brian mentioned, Social Security and Medicare, and educating people on these topics. And there's a simple reason why. The government has created a blind spot for all of you as you embark upon retirement. Social Security is one of their larger income sources you'll have throughout the course of your retirement, and Medicare can be one of your larger fixed expenses you have through retirement. Both of them are administered by the government, but they don't give you a lot of education and insights as to what are your best options. You paid into these programs your whole career. How do you maximize that, the utility of that, to make sure you live a comfortable and confident retirement? And that's what we'll talk about today as it relates to Medicare. So here's our agenda for today, some of the top concerns that people have in terms of costs, as well as the structure of how both Medicare and Medigap work. We'll cover the two different flavors of Medicare. There's traditional Medicare and Medicare Advantage, as well as Medigap, which is some key concerns there I'll share with you to understand. And then we'll go over when you can enroll and what it'll cost. So, to set the backdrop here, the typical household as a 65-year-old couple is going to need roughly $300,000 to cover their medical costs. And what's interesting, if you look at the surveys from a couple of years ago now, surveyed a number of 55-year-olds, people pre-retirement, 1 in 3 was under the assumption that healthcare would be free upon retirement. Yet here it is. You can see it costs you $300,000 or about 12% of your overall spending budget as a retiree. So those are substantial disconnect there between what people expected leading into retirement and what they face now as they embark into retirement. And so you can see the costs are dramatic. And so there are some things you can do to manage those costs so that they won't blindside you or something to happen to your health throughout the course of your retirement. So Medicare was created to make sure people didn't live an undignified end of life and retirement. And so it's administered by the federal government, federal health insurance program. You're eligible as early as age 65, no sooner unless you've been disabled for 2 years. There's 3 main parts, which we'll talk about in greater detail. Part A, which is your hospital coverage. Part B, which is your preventative medicine. Part D for drugs goes along with that, as well as Medigap. Or you can choose what's called Medicare Advantage, which is Medicare Part C. Medicare Advantage, we'll talk about as well, is really a bundled version of Medicare administered by third-party health insurers like Kaiser, for example, who's fairly ubiquitous here in California. So we'll go over both of those tracks. I'll share with you in greater detail in the next slide kind of what that looks like. But as I mentioned, you have to be 65 to get your Medicare. And one thing that comes up occasionally is you have to have 10 years or 40 quarters of effective work history, both to get Social Security benefits from your work history or to get Medicare. Now, you may be eligible if your spouse or ex-spouse had satiated that requirement and you've been married for the correct amount of time, typically at least 1 year for a current marriage, or 10 years for a divorced marriage. So, if you satiate that requirement, you could get Medicare even if you didn't work at all here in the US. But typically we see people have worked for 10 years or 40 quarters of substantial work history, which this year is roughly $13,000 in income. Will get you your 4 credits for this year. Quick fact, if you look at your social security statement at ssa.gov/my account, you'll see your income history there, and you can understand if you have those 40 quarters met. But once you do that, you're eligible for Medicare. And this is really the key decision that you see here on the slide that you need to first embark upon. And so you can see at the top, that's you in the yellow bubble, and 88% of America goes to the light blue on the left, which is what we call traditional Medicare, where you elect Part A, your hospital costs, Part B, your preventative medicine, your MRIs, doctor's visits, all that, Part D for drugs, and then Medigap, or if you are one of the poor people who still watches Sunday morning news shows, you probably see supplemental coverage, Medicare supplements being advertised. That's the same thing as Medigap. It's 2 names for the same thing. And there are some real key moving parts there we'll talk about later that I think are essential to the success of a traditional Medicare retirement. Now, conversely, only 12% of the country takes Medicare through what you see on the right in the dark blue, which is Medicare Advantage. And so, as I mentioned earlier, it's bundled by third-party health providers to administer your Medicare for you. And the positives of that can be they add in things like hearing, vision, and dental, which as of right now are not covered by traditional Medicare, though there was a bill back in June on the House floor, I think, to maybe add those in. It did not pass to my knowledge yet, but maybe efforts are underway. But ultimately, these third-party health providers, they often have, employment year plan providing, and so they're able to extend what they offer to employees out to retirees as well at little to no cost. So the key with Medicare Advantage is it's an in-network structure. Every doctor, just about every doctor in America takes Medicare. If you work out of your network with Medicare Advantage, like in the dark blue on the right, then your costs will jump rather dramatically. So we'll talk about that in greater detail. But as you think about consuming your medical costs and managing your medical costs in retirement, this is your first key decision: is do I take the path on the left with traditional Medicare, or do I go down Medicare Advantage? So what I'll do for today's purposes, because Medicare Advantage is basically built on the chassis of traditional Medicare, is walk through the mechanics of traditional Medicare, how that works, what are the considerations, and then compare and contrast that to the experience of Medicare Advantage. So, my goal today is not for you to pick one or the other. Our decision as to what is best for you and for the outcomes for your healthcare and retirement. So just a couple key notes here on Part A and B. Part A, as I mentioned earlier, is hospital insurance. So you can see on the screen, it does mention skilled nursing, home health care, and hospice care. And hospice care is often associated with end-of-life care, right? One misconception I've found in speaking over this for 15 years is people think that they don't need long-term care coverage because they have Medicare. Well, Medicare is great for rehabilitation. It is not end-of-life care. If you have a fall or you get into a car accident and you have an extended period of recovery where you can't quite care for yourself, you can't do the activities of daily living that you could have prior to the incident, through all your rehabilitation with your doctors, if you get to that point where you can't get yourself to care for yourself any longer, Medicare will kick you off their rolls. And that's where long-term care or self-funding, something like that, definitely talk to Ford Financial Group about that. That's where that would come into the mix. So Medicare will help you rehabilitate to the point where you can care for yourself. But if you can't get yourself to the point where you can care for yourself any longer, then they no longer cover you. So, and we'll talk about deductibles and the like as well, but I want to make sure that was clear because that's a common misconception. Part B is your doctor's visits. I was supposed to see my doctor later today, and she just called and rescheduled because she's on vacation again. But the doctor's visits, you have a 20% copay, just like most employer-sponsored health plans. So they pay 80%, you pay 20% for doctor's visits, diagnostic tests, outpatient therapy, and the like. Part D for drugs, easy to remember, covers prescription costs. You have to be enrolled in A and B. If you don't enroll for Part B and Part D when you're first eligible, then and when you need to, rather, I will talk about what that means in a second, then there's a pretty steep penalty involved. And we'll cover that in a little bit, but I want to make sure you're aware. Think of it this way. If you don't take action and you have no insurance covering you for any defined period of time, you're free riding the system, meaning you are out there in the public, could get into a car accident and the like, and without insurance, you could cost the system millions of dollars, right? If you had an incident. And they want to avoid that by penalizing you if you are going to do that, so that you won't, or at least using that penalty money to recoup some of the losses if you do. And so I'll show you what that looks like, because you can see here Part B, and this is really some of my favorite things to think about. If you're a pre-retiree, say you're 5 to 10 years out from retirement, look at these numbers and understand where you might fall based on your modified adjusted gross income. Okay, what makes your modified adjusted gross income modified for most people is you have your adjusted gross income from your 1040 on your tax return, plus you have to loop back in any municipal bond income. I know Brian and I are both located in California, and I don't know if you may have heard, we have pretty obnoxious state income taxes here. So if you have municipal bonds that don't pay California state income tax, good on you. But that income will be added back to your adjusted gross income for your Medicare purposes. So it can be a rude awakening for some people who have a substantial muni bond portfolio when they see what they're paying in Medicare. I just want you to be aware of that. But it's interesting. You look, if you're a married couple making under $182,000, you're only paying $170 a month for Medicare per person. If you make $45,000 more, $46,000 more, you get to $229,000, let's say, you're only up about 30% on income, give or take, but your premiums have doubled from 170 to 340. So you want to know where these thresholds are. And if you can do some tax planning, some people I know have done Roth conversions when they had the opportunity to do so. So you had a hiccup in a job situation and some time off where you could take the hit on income, do a Roth conversion and give you an element of control of where you take the capital from to fund your retirement, so that you can pay less taxes, certainly, but also pay less in your Medicare premiums. So you want to understand these tables. And the other thing I'll share with you, if you were a retiree here in 2022, the last year in which they have full and complete tax returns for you from is 2020, because they administer Medicare January 1st. And so they certainly didn't have my tax return on January 1st of this past year from 2021. So what they do is they look at your 2020 earnings year. So if you were still working then, say you made $300,000 that year, they're going to assume they have to charge you $442.30 a month for your Medicare, as you can see on the table, right? But if you had a change in life, your qualifying life event, meaning you retired in the last 2 years, which during the Great Resignation many people did, well, you wouldn't be making necessarily that much, and you might have an argument to be made for paying only a 170 instead of 442. So what do? There's a form you can fill out if you want to Google it. It's easy to find, SSA-44, SSA for Social Security Administration. That's who administers your Medicare, -44. I'm a Syracuse alumni, so it's a special number for us at Syracuse. But if you look up that form, you basically can attest that you've had a change in life, meaning you've retired. It's the chief one out there, and that I'm not making $300,000 anymore. I'm making $150,000. So don't charge me $442, charge me $170 for my wife and I. And so if you do that, you can attest. One of the key takeaways would be, don't lean on Medicare to give you advice and counsel. Go to them for order execution. You have to be your own best advocate for your rights as a recipient of Medicare. So I think this slide is, it's good for a little pre-game planning leading into retirement. And as I did mention earlier, you can see the penalty on the bottom. If you don't enroll for Medicare Part B when you're first eligible, which is either at age 65, or if you're over the age of 65, but you continue working, if you were covered by an employer-sponsored health plan, and then you retire. As soon as you retire, that's when you're newly eligible for Medicare Part B. You have 12 months to get your Medicare installed to avoid a penalty. But from there, if you say you went over a year from when you retired to when you put in your Medicare Part B, they're going to put a 10% penalty in there. So instead of $170 a month, you're going to pay $187 a month for the rest of your life. And that number will keep cruising up with inflation as time goes on. So you really want to be careful not to free ride the system, because those penalties will be steep and they're permanent. They live every day in this earth that you do. Part D premiums are very similar in nature, much smaller. So for many of you, it might very well be free, as you can see on the slide here. Yet you don't see full adoption, even in the where it's free, and that's concerning, right? When there's no monthly premium and people don't sign up for this coverage, it can be very helpful, even if you aren't planning on taking any medications. As I've worked with thousands of retirees at this point, we all end up with some sort of cholesterol drug, a statin, something along the way to help you manage your lifestyle as you age into your 80s, 90s, and beyond. And so you want to have this coverage there. And again, if you don't have that in, it's a 1% per month penalty for every month that you don't have Medicare Part D that you could have had it. So be careful of those penalties, because again, 1% per month, or 12% per year, that adds up fast. As your life marches on. So keep that in mind. And again, it's the same exact tables you saw, just with smaller premiums for Part D. Now, really, where for traditional Medicare, I spend the bulk of my time focusing is some of the moving parts around Medigap. As I mentioned earlier, it's also known as supplemental insurance, supplemental Medicare. And so it's offered by third-party health insurers. And there's two key gotchas you need to be aware of as it relates to Medigap. First one is, once you file for Medicare Part B, which we just talked about, that starts a 6-month clock for you to get your Medigap installed with no underwriting. So if you are, say you're 67 years old and you finally retire, say, great, I'm going to leave my employer-sponsored health plan and file for Medicare Part B. Then you have 6 months to put your Medigap in place with no underwriting, just based on your age and gender. So if you're a 67-year-old male, you're going to get the going rate for a 67-year-old male, even if you had a stroke 2 months earlier, right? And so the insurance companies by contract cannot hold that against you as long as you install your Medigap plan within that 6-month window. After that 6-month window is over, they can use that knowledge against you. Your age and your health will generally never work in your favor. So it can be very advantageous to take action during that 6-month window. And I'll share with you an example. I did this seminar, I don't know, pre-COVID, sometime, call it 2018. And a woman told me she was, instead of paying, call it $150 a month for Medigap, she was paying $1,350 a month for Medigap. She had gone 2 years without getting Medigap and been diagnosed after the fact with an oral cancer. And so I didn't know her full financial situation, but it must have been advantageous for her to get the Medigap even at $1,350 a month. But had she taken action in that 6-month window, she could have gotten it for $1,200 a month less. That's a huge cost savings, or a cost for her to endure throughout the bulk of her retirement. So on Medigap, I would encourage you to take action within a 6-month window. Then the other thing in terms of key concerns are, there you can see here, there are 10 plans. G is the most comprehensive plan. And that is the most comprehensive. It covers international, for example, and it covers all of your deductibles and your 20% copays. So the deductible for Medicare Part A starts at roughly $3,000 for the first 60 days. So it's not too high. It's pretty reasonable in my experience. But month 3, days 61 to 90, it costs you roughly $10,000 a month. Months 4 and 5, it'll cost you $20,000 a month. And I know many of you might be in your early 60s or late 50s and not worried about a 4 or 5 month hospital stay. But the reality is, as you age, the odds of you having a longer and extended recovery increase. And you might very well likely be in the hospital if you had an event for 4 or 5 months, recovering and rehabilitating, right? And so with that, that's a huge cost. I mean, you're looking at $50,000, say $53,000 for a 5-month hospital stay. And that it may not bankrupt you, but it sure hurts. And so Medigap can cover all of that, all of those deductibles and all of your 20% copays if you choose Plan G. The other flavors like Plan B may be less comprehensive. So here's the key concerns as it relates to choosing which plan. Think of it, and you'll be having after this conversation that I have a 5-year-old and a 7-year-old, but think of it like chutes and ladders. So you have a ladder of choices here. You can never climb the ladder up, you can only go down the chute. So if you start at G at the top, you can go down to B in the middle, down the chute, but you can never go up the ladder from B to G, because what would you do if you were able to? You're 65, you feel pretty fit and healthy. Maybe we'll get Plan B, pay a little less in premiums, about $25 a month on average, pay less in premiums, and have a little less coverage. But then as you get older, and there's the odds are increasing of something potentially happening to your health in a negative way, then you would jump up to G, but you wouldn't have paid into it the whole time, right? So they don't want you to be eligible for it unless you pay into it the whole duration of when you've had the ability to get it. And so as a result, you can go from G to B, but you can never go up the ladder from B to G. So you want to know the two key concerns of Medigap are the 6-month window for no underwriting as soon as you file for Medicare Part B. And then just know you can only go down in coverage, not up. So often for people who have the means, it makes sense to choose the most comprehensive plan to take all that uncertainty away. And that will be Medigap Plan G. So I would recommend for that. Now I know someone had their hand up. Bear with me a second here. I don't know. Brian, do we want to take questions now?
Yeah, we can take questions. I don't see any questions in the chat or in the Q&A section. So I think we're okay.
Okay, excellent. I saw someone had a hand up earlier. All right, I'll move on. But I'll share with you. I'm originally from the East Coast, so I have no problem being interrupted at any point in time. Feel free to raise your hand or put anything in the chat if you'd like. I'm happy to address it as we go. And of course, as Brian mentioned, we have time for questions at the end as well. Oh, Camarina, I will, let me allow you to talk. Bear with me a second. There you are. What can I help you with?
Hi. Yes, is there a Medicare gap coverage that has or offers a PPO instead of HMO?
Is there a Medigap coverage that has a PPO instead of HMO? Was that the question?
Correct.
Yeah. So,
and what the cost would be for approximate?
Yes. So, I'll share with you. There's a great resource that can help you compare the exact Medigap options and Medicare for that matter. If you're here in California, you want to Google HICAP, HICAP. They're a state health insurance assistance program. They'll give you a 1-hour consultation on which providers work in which networks and what the costs are. So, both with Medigap and as we'll talk about next with Medicare Advantage, you want to do some comparison shopping. Even Medicare Part D is offered by third-party health insurers. And what you'll find is the premiums are different because the providers are different, but the scope of coverage is usually similar, if not exactly the same. So a little comparison shopping, whereas Part B is the same for everybody. But for Medigap and Medicare Advantage, which we'll talk about next, comparison shopping makes a lot of sense. And so to answer your question, Raphael, most of them operate as a PPO. Medicare Advantage, on the other hand, is more like an HMO, like an in-network versus ad hoc. So Medigap, basically, if a doctor takes Medicare, they'll take the Medigap coverage. Whereas this next subject, effectively bundled Medicare Advantage, is an in-network structure. So here, I'll share with you kind of the structures that are there. Most of them are HMOs, right? To your point, where you have to stay in-network. Any of you who have Kaiser are familiar with this structure. And so Medicare Advantage is basically instead of going the traditional Medicare route, you interface just with like, I'll use Kaiser as the most ubiquitous example here in California, and they'll do all the administration of A, B, and D for you. And often they'll emulate a lot of what happens in Medigap within the walls of the Medicare Advantage plan. Some of the particulars might be different, like the deductibles might be 5,000 instead of 3,000, depending on the provider. And some of the moving parts might be different, but the key is they want you to stay in network. If you leave their network for coverage, then it can cost you quite a bit more. And I'll share with you an example. There's a woman I know who, probably it happened by now. She was up in Sacramento, and presuming she had cancer, she wanted to change her plan to move from Medicare Advantage to traditional Medicare, because there's one oncologist who's supposed to be fantastic in the Sacramento region, and she wanted that coverage, and it was not covered by her Medicare Advantage plan, by her HMO. So she moved on to, or she could, we had this conversation 2 months ago. We'll talk about enrollment in a second, but we're in the open enrollment period now from October 15th to December 7th, that will live in infamy. And so presumably she's made this decision now to change her plan, because she could, to see that one specialist because they were out of network. So that's one of the negatives about Medicare Advantage, is it's bundled, but you have to see doctors in network.
Ian, if I could jump in real
sure.
quick with a question that we have in the Q&A box is, what if you are not in California and you're looking for some equivalent for that high cap website? We've got somebody in Texas asking that question.
Yeah, absolutely. So if you type in, it's funny, it used to work where you could type in like Texas SHIP, SHIP, State Health Insurance Program, but then you'll find some stuff like the USS Texas and things will come up. So if you type in medicare.gov/contacts, it'll get you to, you can pick your state from that list and get you to, in a lot quicker fashion, to what you need. Every state has kind of a unique name for their plan. Often, I don't know what Texas's one is, but here in California, it's HICAP, HICAP. But medicare.gov/contacts will get you where you need to go.
Thank you.
Of course. So, Medicare Advantage can be a nice way to go. And, I share with people, if you know where your kids and ultimately your grandkids, if that's a consideration, might be, and where you want to be, if they're local here in the area and you're covered by like a Kaiser, that's great. I grew up in New York and Connecticut where Kaiser is unavailable. If I was covered by a Medicare Advantage plan by Kaiser here in Concord, then I would have to leave Kaiser and move to, say Blue Cross Blue Shield or some local provider in Connecticut where my mom resides now, to have my Medicare Advantage coverage. And so the moving parts within the programs might be different. So it could be a nice way to access your Medicare, but there are portability concerns and network concerns you want to be mindful of. But I will say they add in hearing, vision, and dental, typically at no cost altogether. So I'll share with you here, we have two slides kind of comparing and contrasting the pros and cons of traditional Medicare versus Medicare Advantage. So, as I mentioned earlier, traditional Medicare, you can see 98% of doctors in America, which is, I like to think that's enough. It used to be 99. I'm sure there's some that, they don't get paid quickly from the government. You may have heard of that. So some of them may have opted out if they don't need it, but most doctors still take it. And you'll see only about 34% of people take the Medigap supplemental coverage. I think that number probably should be higher for those who can afford it, because it really takes a lot of the guesswork out of your costs. So and again, it's portable. If you move from California to Texas and to Illinois, you're going to have Medigap or Medicare doctors available to you, where the same is not true necessarily for Medicare Advantage. It is an 80-20 plan. Unless you pick Medigap to absorb that cost, you're paying 20% out of pocket for all of your interactions, and you have to get hearing, vision, and dental coverage elsewhere. Funny enough, a lot of people I know have chosen to go to Costco for their vision coverage. Apparently has a very affordable, good vision program. And just to take a brief step back, as it relates to insurance in general, which Medicare is government funded insurance, think of it as pooled risk, right? My wife and I, we have 2 children. So technically we'd be a pool of 4, right? So I would be 25% of the risk in that group. If you join any other pool where there's 2,000, 3,000, 4,000 people, you represent a lot less risk, which means you'll have a lot less premium associated with your healthcare.
Ian, if I could jump in with another question for you here. This is from someone asking that they have, well, specific to them, they have a Medicare PPO Advantage plan. How complicated and costly is it for them to move to traditional Medicare during open enrollment?
Well, that's a great question. Actually, it kind of goes where we'll be going anyway in a second. So I'm happy to answer it now. Effectively, the open enrollment is right now, October 15th to December 7th. It's not that complicated with one key concern. If you're leaving Medicare Advantage and going to traditional Medicare, again, think about it. You're kind of past that 6-month window, right? Because you've been paying for Medicare Part B. Now, if you have a Medicare Advantage plan, and it depends on the plan, most of the major providers associate this quality, but if it has substantial coverage, meaning it emulates a lot of what Medigap has to offer, you'll be grandfathered in to that 6-month window. So that'll start from when you switch from your Medicare Advantage to traditional Medicare. You'll start your 6-month window at that juncture to then get your Medigap installed at that point with no underwriting. Now, if you're 69 years old, not 65 at that time, right? You've had your Medicare Advantage plan for 4 years, and you make the switch to traditional Medicare right now, you'll be a 69-year-old male or female, right? I think it was Joanne, so assume you're a female. A 69-year-old female, you're going to get the going rate for a 69-year-old female, not 65, like had you done it 4 years earlier. It'll cost you more, and it may not be a lot more, but age never works in your favor as it relates to risk for healthcare, right? So it'll cost more, but won't cost King's ransom more, I would imagine. But I would be sure to make sure you're grandfathered in for the Medigap. And that's where an organization like HiCap could help you understand your current coverage. Does it have what it takes to get you grandfathered in, to get your Medigap installed with no underwriting? If so, I would say you could probably go for it. If not, you may want to consider hanging in there with the Medicare Advantage, depending on your situation. And as just to wrap up on the Medicare Advantage part, as it relates to that, you have your all-in-one healthcare package here, where you've got dental and vision often included. Typically, I mean, for example, Kaiser, I think is $15 a month extra, and that's it. So it's very cost effective. And what we have some examples to kind of show what the cost might look like in the next few slides. But as I mentioned earlier, if you go out of network, you may have a substantial cost. Many of them have, emergency provisions if you're traveling and something were to happen. But if you want to go see a specialist, it's out of your network. You're going to pay out of pocket pretty substantially, from what I understand. So you want to understand those consequences. But if you spend the bulk of your time locally, and I will say many, but not all of them, have international riders as well involved. So just be careful of that. I know people told me all the time that they, used to want to travel overseas. I think we're back to that now. And so if that is a concern of yours or something you want to accomplish, make sure you understand the scope of the international component, because not all plans cover events overseas. So from a cost perspective, here we'll do a comparison between two options for traditional Medicare and Medicare Advantage, because you can see here, Part A costs you nothing. I will say this, it's interesting. This has come up a lot, so maybe I'll just throw it out there now. The Part A costs you nothing. You paid for it through your FICA taxes. That's why they want you to work for 10 years or 40 quarters, because you're going to pay for it through your payroll taxes throughout your working career. But once you're retired, it costs you nothing further. So some people will say, well, Ian, is there any negative to turning on your Medicare Part A if you're still working over the age of 65? And there's two things I want you to think about as it relates to that, if that applies to you or someone you know and love. No, there is not a real negative there. And what is interesting is, I would say anecdotally, about 1 in 5 times I've worked with people on this, we've had success in getting them to drop your employer-sponsored healthcare plan premiums. So if you are working over 65, call your benefit health provider and say, hey, how does my health plan here at work interface with Medicare Part A? Because if they make Medicare Part A primary, not secondary, then that Medicare plan, which costs you nothing, will absorb some element of risk that you represent to the employer-sponsored health plan, and they'll drop your premiums. The most I've seen someone save $350 a month from their employer-sponsored health plan. I don't know if it was for both spouses or what have you, but they were pretty happy with that conversation because it cost them nothing to save them $350 a month. And I would say not all plans do that, clearly, but it's worth a phone call if you're working over the age of 65 to say, hey, if I sign up for Medicare Part A, will it help me? Now, if you're on a high deductible health plan, which has become more popular, so that you can access an HSA, health savings account, which is a relatively new, I don't know, 10 years or so innovation, then if you file for Medicare Part A, you're no longer eligible to contribute to your HSA. So if that is a goal of yours, I would not turn on Medicare Part A, because once you do that, you can no longer contribute to your health savings account. So just be mindful of that. But if you don't have a benefit at work to drop your premiums, then don't file for Medicare Part A, keep contributing to your HSA through your high deductible plan. Then when you retire, you can use those HSA funds to pay for your healthcare costs. So Part B, as I mentioned, is the bottom rung is $170 a month, can be over $500 a month, depending on where you fall in your income situation. Part D, the national average is about $33 a month, but for many of you, it might be zero is the lowest cost. Then Medigap runs about 150 or so a month, 144 here. So total out of pocket for traditional Medicare on the lowest rung would be about $347 a month. Now, what's interesting is if you look at Medicare Advantage, you have your base premium, which is identical to your Plan B, Medicare Part B premium, right? So if you do the bundled version, it would be 170 up to 42. But then the national average is about $19 a month of additional fees, but often that includes hearing, vision, and dental, right? So it can be very cost advantageous to choose Medicare Advantage, but you have to stay in network. And so those are the pros and cons there you want to be mindful of. And so share with you kind of an example of the two people and their situations as they're planning on retirement. We've got Mary, age 65, with a $70,000 income. So she's not going to pay anything for Medicare Part A, as we talked about. She's at the lower bracket, so 170 a month for Part B, 0 for D. But her Medigap plan she chooses is 144 a month, and that's I think the national average for Part G. Just so you know, it's a little higher if you're in high income areas. They base it on the median income by geography. I think it's by county. And so here in California, you should expect to pay a little more, but it won't be more than no more than 200, I wouldn't imagine, a month for your Medigap. So Mary out the doors, call it $315 a month, and her Medigap covers her copays and deductibles for parts A and B. So all she's really got to cover at that point is hearing, vision, and dental, and then ultimately at the end of her life, long-term care costs, right? And so that's where having long-term care insurance would come into play, and kicking the tires on the Costco's of the world for vision and the like. But mostly, because of that Medigap plan, removing that uncertainty, they're going to pay for all of her copays and deductibles, so she can budget $315 a month and know that just about everything she has to worry about is covered for her healthcare costs in retirement. Now, this gentleman, David, has a higher income at $130,000 annual income. So he goes with Medicare Advantage, the bundled version. Because he's at a higher income bracket, instead of paying $170, he's going to pay $340 for his Part B premium. Again, you can't avoid that. And then he has his $19 average surcharge for the provider. So he's looking at $359 per month, but he doesn't have to pay for Medigap. He should have some copays, but the plans are all different. So you really want to understand the way the plan works. Some of them have subsidies for those copays, like a Medigap plan. So he would still maybe have to pay for hearing, vision, and dental. But again, many of those plans add that in at little to no cost. So it's very plan specific based on the provider. But you cannot avoid long-term care, even with Medicare Advantage. So, and then he is, as it mentions here, he is restricted to his network of doctors. If he goes outside of his network, it'll cost substantially more. So, those are kind of two situations just to bring to life some of the ideas you want to think about as you're deciding, do I go down traditional Medicare or Medicare Advantage? and what are the pros and cons based on your situation, what you know about yourself, and you anticipate for your own retirement. As we kind of mentioned, you're eligible to enroll for Medicare as early as age 65. Now, if you're collecting Social Security before 65, you'll automatically be enrolled for Medicare at age 65. And what you'll see is, I've heard this more than once, so I may as well bring it up. What you'll see is, hey, well, Ian, I had Social Security and then I filed for Medicare and my Social Security went down. What a bad deal. Well, no, it didn't actually. What happens is Social Security administers your Medicare. So if you're collecting Social Security, they're automatically going to deduct your Medicare Part B premiums from that Social Security before you receive it. So yes, your payment may have gone down, but it went down by the amount you would otherwise have to write a check for Medicare. So you would never get a bill, but your Social Security would decrease by the amount of your premium. Does that make sense? And so, be mindful of that. If you're not enrolled for Social Security at age 65 and you decide to file for Medicare, you're going to get a bill in the mail, and you have to pay that off every month. So you can enroll 3 months before, the month of, and 3 months after your 65th birthday. If you miss that deadline and you're not covered by anything else, then you have to wait until the general enrollment period, which is the first quarter of each year. And as I mentioned earlier, but just to underscore, there is a penalty, 10% for each full 12-month period that you could have had Part B, and you were not covered by an employer-sponsored health plan or by anything else, and you failed to enroll. Now, if you were covered, there is a form for you to fill out. Say you work beyond the age of 65, we see it often, and I hope all of you love your jobs and want to work until 70. But if you do that, there's a form called CMS-L564. I know it rolls right off the tongue. CMS-L564. If you look that form up, basically you're 70 years old at that point. You decide, I'm going to retire. All right. Well, then you retire and you send that in to your benefits department at work. You fill out that form. They fill it out as well, and they send it to Medicare saying, hey, Brian, he looks young for 70, but say Brian was 70. Well, Brian was working this whole time. He was not free riding the system. Don't put any penalties on him because he was covered by an employer-sponsored health plan from 65 to 70. They'll fill that out, and so you won't be assessed the penalty. And when you can do that is interesting. Say, you're 70 years old and you retire. Well, you're past your 65th birthday. You have a special enrollment period. It's 8 months after you leave an employer-sponsored health plan. So whenever that might be, after the age of 65, and you can sign up for Part A or B anytime during that window, that 8-month window. Now, one thing to note, I've worked with a lot of HP alumnus in the area. There's a misconception that they have retiree coverage through their employer-sponsor. Their employer offered them some sort of healthcare benefit in retirement. They say, well, I don't need to sign up for Medicare because I've got this. No, by and large, those act like Medigap plans. You may not have to sign up for Medigap because the employer will, subsidize it through their retiree healthcare plan, but that doesn't mean you have what they call substantial coverage. So you would still be assessed a penalty if you're out there for over a 12-month period, even if you have a retiree plan, and even if you have COBRA. COBRA doesn't stop that clock from running. And often COBRA is quite expensive compared to Medicare. So I wouldn't see COBRA as a viable replacement for Medicare from a cost perspective. I see a question just came in from Gene. Do all Advantage plans require you to still pay your Medicare Part B premium in addition to their premium? Yes, the Advantage plans. Now, I did work with a Kaiser doctor in San Francisco who Kaiser subsidized his premiums, which was unique, but he still had to pay them. So the way it's structured is whether you're under traditional Medicare or Medicare Advantage, you pay your Part B premiums. You're going to pay that amount. Now, he got his refunded by his employer. They basically paid him back for what he had to pay. He just had to send in the invoice basically every year. But yes, you still have to pay your Medicare Part B premiums. And then Medicare Advantage, the providers have some surcharge on top of that to do the administration and often to add in hearing, vision, and dental for you. So there will be some surcharge in Medicare Advantage above and beyond that, but the base for both will always be that Medicare Part B premium, which ties to your modified adjusted gross income. Good question, though. Now for Medigap, aka Medicare supplement, you have that 6-month window I mentioned. Whenever you enroll for Part B, which is as early as age 65, but it's whenever you would ultimately leave an employer-sponsored health plan and pick up that coverage that does have that premium involved. That starts at 6-month clock to go with no underwriting, regardless of your health status. But after that's done, full medical underwriting, it says may occur, it will occur. There is not a provider who's generous enough to not do that. And so you will have that occur, and I cannot imagine it working in your advantage. So, for many of us, even if you have a good health history, it behooves you, if you want to remove the uncertainty in traditional Medicare, looking at Medigap and taking action within that 6-month window is a critical play for you to make to live a comfortable and confident retirement. Drug program, of course, you can enroll during that 7-month window. And as we kind of touched on with the Medicare Advantage question, you could change plans from, I don't know, Humana to Blue Cross Blue Shield providers, whatever you want to do. You can only do the changes to plans, as we'll talk about later, from October 15th to December 7th. And as I mentioned, that penalty for not taking action and not having coverage is 1% of times the number of months. So 1% per month times the number of months in which you did not have coverage that you could have. And that penalty will last forever. So it can be a pretty steep penalty. And what I see often is people don't take that up and decide to get it later when they feel like they have a greater need. I just say, the cost could be free, depending on your income bracket, right? So it could be literally no cost. We only see about 85% of people that could have it free even sign up. So it means 15% of people don't know that they could benefit from having this, and they would at least not rack up a penalty for not having coverage. So I would encourage you, depending on your situation, it's often advantageous to sign up for Part D right when you're eligible. So as I mentioned, the open enrollment period to make changes is October 15th to December 7th, where you could go, as was mentioned earlier, from Medicare Advantage to original Medicare or vice versa. You wouldn't want to do it too often, because remember, as you age, they're going to use that information against you. They may or may not be able to use your health history against you, but they'll always know how old you are. And that generally is not going to work in your favor. So you don't want to make changes willy-nilly, but if your circumstances change, or you decide you want to see a new doctor because of a different health event, you can make that change from October 15th to December 7th every year. So, those are really some of the key considerations on Medicare as a whole. So you want to think about what doctors do you want to see, what needs do you have now, or do you anticipate from your family health history or things like that? How much do you plan on traveling, and what's the scope of coverage there? Where is your family and loved ones, and is there a chance you might move? For example, I think it's AARP. It's either United or Humana, I can't recall, but AARP has a Medicare Advantage plan, and they have a more national footprint than something like Kaiser. So if your kids live in Kansas and you're thinking, well, one day I might move from California to Kansas or Texas to Kansas, well, then you might not want to choose a Kaiser. You might want to choose something with a more of a national scope, so you wouldn't have that hiccup in service by moving, if that's something you think even is in the cards down the line. So, and again, that's where I would say, I'll point to this here, Medicare.gov/contacts. For those of you in California, it'd be HICAP, but that's where you can go to have a conversation with an individual. Typically, you'll find their benefits providers locally that offer health benefits to employment bases, and they are sanctioned by the states to do a 1-hour complimentary consultation. They used to work out of senior centers, and they were over Zoom like we are now for a good period of time. But I think they're back in person in many jurisdictions now. But reach out to your HICAP representatives, or your go to Medicare.gov/contacts if you're out of California to find your local people. And as you are getting close to retirement, I would really implore you to sit down with them. They can be a fantastic resource. They're very knowledgeable, very neutral. They're not going to push anything, but they can be very helpful to help you make an informed decision based on everything about your circumstances. So, Brian, I know we covered a lot in a relatively short amount of time there. Yeah, definitely want to open it up for any other questions.
We definitely covered a lot. Well, there's a lot to cover right here. I'm gonna get my video going back again. There's a lot to cover. There's a lot of stuff, and I know a lot of the Medicare stuff also kind of ties in with Social Security, and you alluded to that in the way that Medicare gets billed and things like that. And these are pretty important components of looking forward into retirement and accounting for these things. And I know we include the cost of Medicare, for example, in the retirement plans that we run for people, and we've been doing that for quite a while. So I think everybody knows Medicare is an important element here. I know that we have lots of people that wait until 65 to retire simply because of Medicare and the healthcare coverage offered by that, which just goes to show how critical it is for everybody's retirement plans. I am not seeing, we'll give it another minute or so. I'm not seeing any other questions. I think it's helpful that we were able to answer some of those questions along the way, whether it was, the high cap equivalent website if you're not in California, and then switching from the Advantage plan to kind of traditional Medicare and so on. An interesting component here of your age working against you as if you're toggling back and forth, especially after a few years. So you don't have to make the right decision right out of the gate, but it helps to get it right the first time, right?
Exactly.
Yeah. Well, good. Well, I think we will leave it there. Ian, I really, really want to say thank you. Your expertise in this subject matter is second to none, and is tremendously helpful for our clients to kind of get a handle on this. Perhaps we can entice you to come back again and chat about this some more for people who missed this. So I think we'll leave it there. Oh, I see one question kind of as we're wrapping up. Oh, Gene Gordon says thanks, which is
my
great.
pleasure, Gene.
I think it was helpful. It was helpful for not just Gene and for me, but for everybody else that was on this. So I will just leave it here. If there are questions that you have after listening to this that didn't get answered today, you can email me. You can email us on our general inbox at info@forwardfg.com. We'll leave it there. Ian, thank you again, and I look forward to seeing you soon.
Thank you. Appreciate it.
All right.
Thanks,
Take
everyone.
care.